from Surgery 101. I'm Jonathan White. I'm a general surgeon here in Edmonton, Alberta. And we thought we'd do a little video showing a discussion of various people we've been talking to about the effects of COVID-19 on medical education. So you'll see from the screen, we've got myself, we've got Michelle Lindberg, who's here. She's our medical education program assistant in digital education. We've got Kellie Wright-Tootoosis, who's our summer student this year. We've got Shannon Erichsen, who is the team lead for undergraduate surgical education at the University of Alberta here. And then we have Patrick Ciechanski, who's our third year medical student, who's actually on a clerkship in surgery, which was disrupted by the pandemic. Obviously, COVID-19 has changed a lot of the stuff that we were planning to do this year. So we had a variety of different plans for our summer studentship, and we had to adapt those in response to the COVID-19 pandemic. And all of us have learned this new reality now. So we're not meeting in person anymore. We're meeting on platforms like this, like Zoom and Skype and FaceTime and that sort of thing. We're having to get used to working from home or working in our offices and being socially and physically distant from people. And being careful about washing your hands and touching your face and all that sort of thing. So actually, Kellie for the last month has been looking at how medical schools and medical students have basically been responding to the pandemic. So we thought we'd share some of those findings through this video, and then we invited Shannon and Patrick along to talk about their experiences doing this for real. So I guess. Michelle, did you want to kick us off? What have you observed so far about how our medical schools have responded to the COVID-19 pandemic?
Yeah, thanks. So from just viewing online through social media and some conversations with Shannon keeping me up to date as to what was going on with our elective students, I've kind of taken away three kind of points about how the medical schools are doing with this. I think a main focus for a lot of them across Canada has been minimizing disruption to academic life. They've been working on administrative challenges and a big focus on moving forward. So when you look at the disruptions to academic life, and I know Shannon will talk more about this, on March 13th, classes were suspended. So a big challenge for the medical schools were moving content online. I think delivery was up, 2 or 3 days later on the Tuesday. So students were pulled from rotation, as Patrick will talk about, and teachers were up and online teaching a few days later, which is pretty incredible. And as a previous teacher, I know the challenges and saw lots on Facebook of some funny comments on Zoom University. For administrative, universities and schools, especially medical schools now, are looking at online convocation. So I saw the university posted to kind of their first ever virtual convocation is coming in June. So a big challenge, and maybe something they have to facilitate with students that have worked so hard and are looking forward to the cap and gown. Administration of grades is going to be a challenge for medical schools, as universities have, I'm sure Shannon, you've had a lot of conversations about pass fail or how it's going to look. So that's a challenge as we're looking forward to students moving forward, as well as admissions. And just scheduling. We were just having a discussion earlier about how we finish rotations and ensure all the students meet their objectives and learning goals. So I think those are big challenges that the schools are seeing. And moving forward, I think Shannon and Patrick will talk more about this, but it's optimistic. Students and the schools are excited about welcoming back to classes. I know the University of McMaster and probably more Canadian universities have announced online courses in the fall, but there are different areas where students and teachers will come in contact. But lots on the plates of medical schools and their administrators for sure, John.
I would agree. I mean, I've been doing this for a long time and I've never seen anything like this. I mean, if somebody told me students won't be in the hospitals anymore come March or April, I wouldn't have believed them. If you told me there won't be any graduation this year, well, I wouldn't have believed it. But I also wouldn't have believed how quickly the universities have been able to respond to this, and just how rapidly people have been able to pull together and change the way we do business. So Kellie, do you want to tell us what you've seen, what you've learned from how medical students have responded to this crisis in general?
Sure. After scrolling through social media, I've noticed many students expressing the feelings of uncertainty, frustration, anxiety, and stress. And for many students, the shift to online learning and staying motivated at home was very challenging. Some students described it as being a motivation killer. An article I read by Helen Tang, who is a third-year medical student at the University of Saskatchewan College of Medicine, wrote about how the COVID pandemic has affected her and her classmates. And in her article, she highlights 4 key themes, which include identity loss, helplessness, being sidelined, and overwhelmed with the unexpected changes that COVID has brought. She illustrates these feelings through a series of illustrations, which I will share on the screen right now. Okay, so in this picture, she writes, singularity describes our loss of identity. The woman representing a medical student faces head-on as if posing for a hospital identification photo. However, her expression signals uncertainty. She has spent the majority of her time thinking, walking, and breathing medicine, and now her role is a shadow of what it used to be. To not be studying and not seeing patients, especially when the whole world is focusing on medicine, has been devastating. With watercolor paint, the watercolor paint obscures half of her face and drips down the paper, symbolizing her identity loss. She's forced to ask, who am I if not a medical student? Sideline captures the feeling of being helpless and overwhelmed. As medical students, we are caught somewhere between being a member of the general public and a part of the healthcare team. Though we possess more knowledge than the average individual, we are forbidden from practicing our skills and serving our community frontline. We are overwhelmed as we watch the crisis unfold, as symbolized by the ominous clouds of headlines above the hospital. The hospital doors in the illustration are closed, as well as depicting our inability to help alongside the frontline. Connection illustrates how we have meaningful communication with patients despite not having any direct human contact. This illustration is based off a classmate's experience with volunteering at a public health phone line, where she called patients to inform of their negative COVID-19 results. When she told a patient that he was negative, he began tearing up, explaining that the only reason he wanted to be tested was to visit his dying mom. While the disease has seized all in-person interaction, as symbolized by the viral particles separating the student and the man, human connection prevails. The watercolor breaks through the storm of the virus, symbolizing the resilience of this connection. Finally, solidarity represents our willingness to contribute to our healthcare community. Though we cannot be frontline workers, we can assist with their lives. Many students are helping with childcare relief and errands for healthcare workers. The medical student is holding a baby and a bag of groceries, representing how we are giving back to the supervisors and mentors that have spent so much time with us. The illustration is inspired by Rosie the Riveter, a wartime poster that encouraged women to work while men left to fight in war. We feel similar to Rosie. We are not the protagonist of the battle against COVID-19, but we provide crucial support to ensure the continuation of frontline workers. COVID-19 has unexpectedly changed our roles as medical students. These illustrations capture some of the emotions, narratives, and challenges that we have experienced. Though the pandemic has created conflict in our identity and ability to help, we are finding meaning and giving back through our avenues. We are uncertain of how the next few months and years will unfold, but we are hopeful that the turmoil may produce a sense of belonging and common purpose.
What else did you find?
I've seen evidence on social media of students engaging in numerous opportunities provided by this situation. And I'll use some U of A students as examples. So some U of A medical students are aiding in surge planning, where they help prepare for a potential surge of COVID-19 patients in hospitals by researching what other countries have done and creating visuals for planning and working on a physician toolkit. And by doing this, they've saved AHS workers months of work in preparation for a patient influx. Other students across the country have been involved in contact tracing, 811 call answering, babysitting for frontline workers, delivering groceries for healthcare workers and those unable, and directing and advising traffic and drive-through test sites. So COVID-19 has unexpectedly disrupted the education of medical students, but what I've noticed is that they continue to find meaning and opportunity to give back and to help with their communities in any way that they can.
Okay. I would agree. I mean, I think sometimes you could think medical students just been sent home, so they must be like at home playing the PlayStation all day long or something. But in fact, that's not it at all. And most of the medical students that I know are out actually doing something and contributing to this. I think I'd actually respond to some of the stuff you said to say that I think the initial response to this was quite difficult. When medical students were withdrawn from the hospitals, there was a real feeling of paternalism, like it was the parents trying to protect the children and taking them out of the system, and the medical students saying, no, we're adults, we want to be treated as adults, you can't take us out like this. So there was certainly that feeling at the start. The other thing I think is, and maybe I'll share my screen as well. There was an article I came across called Stigma and the Logics of Wartime. And it's just to mention the idea that people talk about fighting COVID and people talking about being on the front lines, you know, those ways of talking, battling an invisible enemy, you know, having the spirit of the Blitz, all those sort of things, those ways of talking move us in a certain direction. Because wars or conflicts and they're won or lost, I'm not sure that's exactly the right metaphor we need for something like a pandemic. So I just point that out as a general observation. And certainly, if you want to have a look at this article by Arthur Rose and Luna Dolezal, it's on here, the Society for Cultural Anthropology. So I thought I'd maybe flip it over to some of the folks who've actually been on the front line responding to this directly. So Shannon's our team lead for undergraduate surgical education. She was right in the middle of the COVID response. So tell us what it's been like for you, Shannon. Oh, I think you're still muted.
Thanks, John. So as you indicated, I'm the team lead of undergraduate surgery, so I'm administratively responsible for the delivery of 2 surgery clerkships to the medical school at the U of A. I think early on, our initial thoughts, it was hard to wrap your head around the gravity and the reality of the situation. I don't think any of us realized that we would be not working in our offices for this long. We have been all working from home since March 16th, so that at this point is a little bit over 2 months. Initially, there was a lot of concern about the unknown of what was going to happen. Some of my staff members were kind of actually even worried about their jobs because they didn't have their day-to-day work. So we shifted to doing tasks that we sometimes don't get a chance to do that often. So we filled our days with that. There was a lot of waiting for the medical school to decide when the students were coming back, and a lot of apprehension around what that was going to look like and when are the students coming back. And there is a wide variety of dates early on across Canada of when different medical schools thought that the students should come back. Even to this day, there are some students that are not coming back until July 6th. Our medical students clinically are coming back June 22nd. So again, now that that date has been firmly set, now we have a plan and now we can start putting the pieces back together. As I said, we are working from home. So that has brought a whole bunch of different challenges. Various people have different levels of tech at home. I'm right now in my bedroom with a Zoom background. So that's sort of been challenging for some members of our team. Urgently, the Department of Surgery had to get everyone to have remote access to their computers at work. So that was financially kind of a hit as well, and something that we didn't have before that we now have. Going forward, though, I think that some things we have found are a little bit easier. So meetings through Zoom or Google Meet or whichever video conferencing platform we've been using. People have noticed that there's a lot more attendance at meetings because meetings are easier to attend now that they're video conferenced. So we'll see what that's like going forward. We do have a plan now. So the plan is that the rest of the rotations for the year 3 students that were disrupted, there are 75 students that still have to do general surgery. The clerkships are shortened to, they've taken a couple of weeks off of those clerkships. We've sort of changed how we're going to deliver those clerkships. We still have some questions about stuff that we did in person, so suture skills and their OSCEs. We still have a few things that we need to work out, but we're hopeful that we can still keep the medical students safe and deliver the clerkships that will hopefully help them going forward.
So, Patrick, tell us what it was like for you going through this. I mean, there was a day then you got an email that said, "Hey, don't come to the hospital today because of COVID-19." So, what have the last 2 or 3 months been like for you as a medical student?
Yeah, so I actually didn't even get an email. I was actually just my last day. I was just walking around the hospital, and I happened to be on my general surgery rotation, and all of the ORs were canceled. The hospital was kind of empty. You kind of just walk the halls, bump into other medical students who no one really knew what was going on, and was a sense of uncertainty. And then a couple of days later actually came the email where we were told that we were pulled from clerkship essentially. And so this was a pretty drastic change because, you know, being a clerk, the expectation is that you're spending the majority of your days and nights kind of interacting with patients and healthcare teams. So kind of going from, like, we went from 100 to 0, like just over the course of a weekend. So it was quite a drastic change. And so, you know, as you mentioned, it's been about 2 months now. And so over the course of those 2 months, there's really been kind of a spectrum of thoughts and emotions regarding this whole concept. So, you know, I have to admit that kind of early on, right when this happened, I was actually a little upset that we were pulled from clerkship. You know, I kind of fell into that camp of people who, you know, thought that despite this pandemic, we should kind of continue our work in the hospital, you know, until a situation arose where, you know, we're clearly being exposed to significant harm or contributing to the PPE shortage, or, you know, just causing more problems than we solved, which isn't that hard being a medical student sometimes. But yeah, I don't know, kind of as you mentioned, Dr. White, I was a little upset because I've been told that, you know, I'm a medical student and I'm a part of the healthcare team. You know, I was told that, you know, I actually have some sort of a role in the healthcare team. And then all of a sudden now we're just being told to sit on the sidelines. You know, at the time, I thought as a medical student, I'm supposed to be in the hospital. I'm supposed to be learning from patients. I'm supposed to be learning from situations like this. And this is a particularly unique, possibly once in a lifetime situation where I really could have had a unique experience and learned quite a lot. And, you know, overall, I just kind of felt like I was being robbed of the experience a little bit. But, you know, time went on and I put some time into just kind of reflecting on everything which was going on around me, and really just realized that this was, you know, it was a sense of uncertainty which was going on in the background, you know, at the time that we were pulled, and kind of the weeks leading up to it. You know, I was uncertain when we would return to clerkship. I was uncertain, you know, if we'd be starting residency on time, uncertain if we'd have time to do any electives, uncertain, you know, would I get a break before residency started? You know, I was on my general surgery rotation, which, like, it's something which I want to do. And, you know, I was uncertain if I would get any time back in that general surgery block, which, you know, is a little frustrating. And I think it was this entire sense of uncertainty, which, you know, did cause these, more negative feelings. But, you know, as time went on, just realized it's not the end of the world. It's really not the most devastating thing. You know, if anything, there were a whole list of positives which came out of it. You know, if anything, it kind of solidified my interests. I realized that if I'm this disappointed being pulled from a rotation which I'm liking, it's probably a good sign that maybe I actually really do like that field. You know, what I was hearing from colleagues was that, you know, clinically and in ORs and stuff, there was a huge reduction in the caseload, for example. And then, you know, I thought to myself, it's probably not the best learning environment anyways. So, you know, I don't know how much clinical expertise you can really, or clinical acumen you can really develop if you are only seeing a limited number of patients. And, you know, at the end of the day, just from this, a whole bunch of different opportunities arose as well, which were quite exciting as well. Yeah, so I can chat a little bit about those if you would like. So, yeah, so I mean, kind of challenges and opportunities which came up. I mean, the big challenge is it's just a abrupt disruption to your everyday life. You know, as I said, I was on my surgery rotation, so I went from, you know, kind of a life where I was waking up at 5 a.m. and sometimes staying well into the evening to, you know, one where I could just sleep until the evening and then awake, like go to bed at 5 a.m. if I wanted to. It was just completely, everything kind of just went completely upside down. And, you know, on top of that, you have all of these responsibilities and some sort of a sense of accomplishment, which you get from performing those. And all of that was just wiped clean. You know, there's no more learning going on in the background. I wasn't really developing any skills. And, you know, somewhere deep down, I thought like, you know, maybe in the future, maybe I'm not going to be a good physician because I'm losing kind of this valuable time early in my training, which to me was, you know, that's core knowledge, which I should be learning. But, you know, the more I thought about it, the more I realized it's not a great learning environment with reduced volume load. You know, over the course of like a 30 or 40 year long career, losing a couple of weeks of a block is probably not going to it's not going to be a game breaker by anyways. You have years and decades to develop expertise in a skill. And so it really isn't the end of the world from that standpoint. But yeah, like I mentioned, there was a handful of new cool opportunities which did come up to medical students, some of which we actually just discussed. So, you know, some of the things I was involved in included the COVID contact tracing for Alberta Health Services. So, you know, briefly, just to summarize it, essentially we're a team which works with public health, and we contact individuals who have been identified or potentially identified as having COVID-19. We disclose their diagnosis. Over phone, we kind of try to determine their clinical status, and then we inform them of isolation precautions and try to determine, you know, who they could have gotten a virus from and who they could have given it to. And, you know, it was actually a really cool opportunity. And again, something which was completely unique. You know, there was a sense of responsibility and accomplishment to it. You know, we had to utilize these skills which we did develop in medical school so far to actually try to perform real medicine. Like, we had to phone people and try to determine, you know, based on that conversation, should we be referring this person to the hospital? Like, should we call EMS for them? And so it was kind of a unique way to develop some sort of a clinical skill, which was quite exciting. And there was like a real sense of accomplishment from it. You know, every day, like Dr. Verna Yu, who's the president and CEO of AHS, she put out a little newsletter saying how many new cases of COVID were reported in Alberta. And it was actually a really cool feeling knowing that, you know, you were the person who was responsible for calling one of those individuals and informing, you know, how they should best care for themselves and those around them, and kind of just contribute to that public health effort and, you know, help flatten the curve. So it was a very cool, unique experience which arose from being pulled from clerkship. there were a couple other things which I got involved in as well. I did some training to become a Connect Care super user. So Connect Care, it's a new electronic health system which is being rolled out across Alberta. And so when that system gets rolled out across all sites across Alberta, I'll be able to provide support now to healthcare teams, which again, something which is very cool. Very cool and exciting, I think, moving forward here. And then in addition to that, as a medical student, it's always hard to find time for research. So you can't really put off any excuses anymore. So I was able to spend some time just catching up on some research, doing some writing, doing some reading, which was quite nice as well. And then, finally, from a personal standpoint, there, some of my hobbies, I have had some more time to commit to those. I got chances to get back into some of my old hobbies as well, things which I typically didn't have time for because of, just the busyness of being a medical student. And so overall, it's just been really nice. There's been some unique opportunities which arose from being pulled. And at the end of the day, I think I did a full 180 coming from a place of kind of discontent and upset to one of, acceptance and realizing that this might just be a blessing in disguise, actually.
Okay, thank you very much. So before we wrap up, let's talk about what happens next. How do we get out of this unique situation? Because we're all going to remember the spring and summer of 2020. We're all going to remember where we were when we first heard the term COVID-19. So Shannon, when does medical school start again at the U of A? When do the students come back? And is it going to be different when they come back?
So what they've done is, like I said before, they've got a boot camp of 3 weeks starting June 1st, where they're going to get a whole bunch of didactic material via Zoom for 3 weeks. And what that has done is it's allowed the clerkships that are still remaining to pull a lot of their didactic material out of their shortened time and put them all in the first 3 weeks of June. Those will be recorded so students can refer to all of that material at any point. So those are the first 3 weeks of June. Clinically, the students are back June 22nd. The disrupted rotation, which Patrick was a part of, gets 2 more clinical weeks to be on the ward and in the OR and in clinics. We will have an assessment plan at the end of those 2 weeks. And then going forward, our clerkship in general surgery in year 3 is usually 6 weeks, but what they've done is they've taken 2 weeks off of all of the clerkships. So those clerkships that were 6 weeks are now 4 weeks. Those clerkships that were 8 weeks are now 6 weeks. And that will get us through the next 3 rotations left that is still in year 3. And the transition for the year 2 students into year 3 will start with link block. They will go right into electives, and we don't get them. We don't get our first cohort of the next year until October 5th. So usually those students would have started at the end of August, but they've held them back for 6 weeks, and we won't get the new set of students until October 5th into year 3.
So it sounds like you've got a pretty solid plan for getting things back to normal. So Patrick, are you looking forward to going back? Are you afraid of catching COVID?
Yeah, so I mean, first off, I'm very excited to be returning. I've been away from about 2 months from this now, so it's nice to get back to it, and I think it's going to be a bit of an adjustment period, back to kind of waking up early again, kind of getting back to the books quite regularly. It's going to be a bit of an adjustment period, and things are going to be different, but in the background there might be a little bit of a concern about catching coronavirus. Fortunately, in Edmonton, we do have quite a low caseload, and hopefully over the coming month or so here, before we do return to the hospitals, that'll continue to make its way down. And I don't know, I've had good faith in the system that precautions will be in place, and that there is some protection for medical students by the healthcare teams to ensure minimizing exposure risks.
Okay. So before we wrap up, I wanted I want to give everybody a chance to share what's been your most memorable thing in the last 2 or 3 months, the most memorable moment that you've had that's kind of stuck in your mind over COVID-19. I'll go first. I think probably the most memorable moment that I've had is our team, the team that I work with here at the Royal Alexandra Hospital, really came together, and we had a conversation where we talked about having each other's backs, because we thought we were going to die, right? We thought we were going to get COVID. We thought we were going to be like Italy or Spain or the UK or China, and luckily Canada's been a whole lot better than that so far. So I think it was that moment when a colleague said to me, "I've got your back and you've got mine, and we'll work out the rest later on." There's been a real sense of solidarity. Shannon, what's been the most memorable moment for you?
I don't know. I mean, we sort of have that as well, but I think that I would like to think that I was very reassuring to my team, because I think that members of my team were very uneasy, and so I felt that it was sort of part of my job to just be calm and just reassure them that this was going to be okay and that things were going to be okay. So I think that would be sort of the thing that I remember the most about this. And working from home, which I have never done before in my life. So that's been very different.
So Patrick, what's the most memorable moment for you the last 2 or 3 months?
Most memorable, kind of the one that actually just pops into my head, was that final day of clerkship, actually. It really was a truly eerie sense walking around the hospital on a Friday midday, and you look out into the atrium and there's no one there. You try to walk around the wards, the surgery wards, just to go see anyone, and the beds are cleared, like it's empty in there. And it truly was just a very eerie, interesting kind of visual, which I actually don't know if I'll ever have that again in my life. So it was a very memorable moment for sure.
Michelle, what's your memorable moment?
Oh, I've been fighting from trying to rub my nose for the last little bit here. I'm trying to be COVID, so if you're seeing me make rabbit faces. I think what popped into my mind was, and this isn't work related, although I have a fabulous team, was we went out for donaires and the guy passed us the pay machine attached to a hockey stick over a little barricade. That's my yeah, COVID moment.
That's a very Canadian way of physical distancing, right?
Yeah, hockey stick away.
Just the right length.
Mm-hmm.
So Kellie, what's your most memorable moment in the last 2 or 3 months?
I guess just staying home and getting to know myself and working from home and having the opportunity to still be able to work during the summer, as lots of students, like their studentships were canceled. So I'm very lucky. I guess just getting to know myself and challenging myself in new ways has been a pretty good opportunity for me during this time.
Okay. Well, so let's wrap it up then. I want to thank everybody for sharing their experiences. This video is going to be on the Surgery 101 YouTube channel and the Surgery 101 app and the Surgery 101 website. So we would encourage anybody listening to this video to share their experience as well. Maybe you could respond to us on YouTube. Maybe you could send us a tweet. I think our Twitter account is @surgery_101. We'd love to hear what your experiences were during COVID-19 as well. So thanks very much for listening, and we'll see you back on our regular podcast episode in a couple of weeks. Thank you very much.